Hello, my name is Radhika Gogoi. I'm a GYN oncologist at Carmenos Cancer Center in Detroit, Michigan. January is Cervical Cancer Awareness Month, and it's a great time for each of us to think about whether we're taking appropriate steps to decrease our risk of developing cervical cancer. Cervical cancer is the fourth most common cause of cancer in women worldwide. In the US, 5,000 women will die of cervical cancer this year. Signs and symptoms of cervical cancer may include vaginal bleeding after intercourse, bleeding in between your periods or after menopause, watery, bloody, or foul-smelling vaginal discharge, or pelvic pain during intercourse. Other risk factors can include early age of intercourse, multiple sexual partners, a compromised immune system, and smoking. But the most important risk factor for the development of cervical cancer is HPV infection. HPV, or the human papillomavirus, is a sexually transmitted infection that is associated with almost all cervical cancers. Most HPV infections are transient and are taken care of by your immune system. However, HPV infections that persist, or infections by higher risk types of HPV, are more likely to cause either precancerous changes or cervical cancer. So, what steps can you take today to decrease your risk of developing cervical cancer? First, seek advice from either your gynecologist or a primary care provider if you have symptoms such as irregular bleeding, bleeding after intercourse, or foul or watery vaginal discharge. Second, make sure your pap smears are up to date. Current recommendations are to have your first pap at the age of 21, and then depending on your age, a pap smear or HPV testing can be done between 3 to 5 years. Both the Carmenos Cancer Center and the state of Michigan have low-cost or no-cost screening programs for eligible patients. Lastly, and probably most important, if you are between the ages of 9 and 45, I strongly recommend getting the HPV vaccine. The FDA has approved the Gardasil vaccine for both men and women between the ages of 9 and 45. The vaccine has been shown to be both safe and effective in preventing both precancerous and cancerous changes of the cervix. With your help, we can eradicate cervical cancer. Thank you for listening.